As an inclusive university, we believe in a world-class education system for all. From the struggle and courage of the Indonesian Revolution for independence, we started a journey to build the nation. As we face rapid cultural and technological shifts, we understand that staying one step ahead of challenges is the way forward. Innovation and transformation are integral to every move we make, including how we deliver education. We translate research into useful products and formulate solutions to societal needs and problems, as seen from our role and contribution to tackling the COVID-19 pandemic. Our new, ever-developing infrastructure with a variety of supporting systems and modern technology is built to accelerate the pursuit of answers while making everyone feel at home. Passions are nurtured beyond academic fields. The facilities that cater to their needs, students are given the space to unlock their potential, unleash their creativity, and reach for the stars. Our dedication to community development reaches far and wide. We synergize and share roles with various stakeholders to build an empowered and resilient community. Unity in diversity. We push knowledge forward and make a high community impact that matters in harmony with our long-held principle, globally respected.
We are together.
Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen, and all of the participants from Asian countries. Welcome to the 10th Communique webinar series, the 2023 Asean Higher Education Conference, organized by Ministry of Education, Culture, Research and Technology, Republic of Indonesia, in collaboration with the Council of Rector of the Indonesia State University, which is held today, the 9th of August 2023. Excellencies, ladies and gentlemen, this webinar is hosted by Universitas Padjajaran in collaboration with Universitas Gadjah Mada, Yogyakarta, Indonesia. And it's such an honor for me, Eta Aurea, to be your master of ceremony today. Well, ladies and gentlemen, Indonesia has the honor of serving as the chairman of ASEAN for the 5th time. This year, in 2023, Chairmanship of Indonesia in ASEAN adopts the theme of Asian Matters, Epicentrum of Growth, which means that ASEAN remains important and relevant to the global community. And one of the most important things is education. So, Indonesia will convene 10 Communique webinar series of the Asian Higher Education Conference 2023 with the general theme, Higher Education, a Catalyst for Growth. Excellencies, ladies and gentlemen, today's webinar will bring the specific topic of post-COVID sustainable healthcare and industry. And the session will be led by our moderator, Dr. Yodi Mahendra Datta, MSc, Ph.D, FRSPH, And here is the profile of Dr. Yodi. Dr. Yodi Mahendra Datta is the Dean of Faculty of Medicine, Public Health and Nursing Universitas Gadjah Mada. He is also an Associate Professor at Department of Health Policy and Management, Faculty of Medicine, Public Health and Nursing Universitas Gadjah Mada. He pursued his master's degree at Institute of Tropical Medicine, Humboldt University, Berlin, Germany, and doctoral degree at Institute of Tropical Medicine, Antwerp, Belgium. Well, ladies and gentlemen, our moderator is already here, so I will greet him first. Hello, good afternoon, Dr. Yodi. How are you today?
Hello, good afternoon, Dr. Eta. I'm fine, thank you. How are you?
I'm pretty well. Great then. We are gonna have a great discussion with all of the speakers and also the participants. Are you ready to moderate the session?
Yes, ready and very much excited. Looking forward to the discussion.
Okay, nice. Well, ladies and gentlemen, please welcome our distinguished moderator, Dr. Yodi Mahendra Datta. The time is yours.
Okay, thank you, Dr. Eta. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Excellencies, Honorable Rector, distinguished speakers, colleagues, ladies and gentlemen. Let me set the stage by highlighting the bad news and the good news. The bad news is, although today COVID is no longer a public health emergency, most likely there will be another pandemic. As we've witnessed, it's very difficult to prevent a pandemic. The good news is, by now, we've gained a wealth of lessons and insights which, if we act upon, should put us in a better position to deal with the next pandemic. In that context, our webinar today will facilitate an exchange of knowledge and ideas on post-COVID sustainable healthcare and industry to depict possible roles of academics in building a sustainable and resilient healthcare system for the future. By bringing together experts from diverse backgrounds, this webinar aims to foster a collaborative and multidisciplinary approach to supporting such system through resilient and agile education, research, and service. With that aim in sight, we present you today 5 leading experts from across the ASEAN region. Each expert will deliver a presentation about 10 to 15 minutes each, followed by brief Q&A sessions for some of the live session. So without further ado, allow me to present to you our first speaker, Honorable Rector of Universitas Gadjah Mada. Professor Dr. Emilia is the Rector of Universitas Gadjah Mada. Previously, she was the Dean of the Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. She's a specialist consultant in OB/GY, and she holds a Ph.D. in clinical teaching from New South Wales. And she also has a Master of Medical Education from Dundee and a Diploma in Medical Education also from University of Dundee. Professor Ova, can you hear me clearly?
Thank you very much, Dr. Yodi.
Okay,
Can you hear me clearly?
Yes, very clearly. Thank you for joining us in your busy schedule. So we have about 10 to 15 minutes for the presentation, and we'll follow with a brief Q&A. Professor Alpha, the floor is yours.
Thank you very much, Dr. Yodi. Let me share the slides. Already seen the slide?
Still waiting.
Yeah. Still waiting?
Okay, we've seen the slide now.
My focus is in creating nationwide research atmosphere in higher education. Of course, as the moderator already mentioned, the main is to prepare new emerging health problems in the future. When we look at the previous COVID pandemic in the last 3 years, we see that the outbreak of COVID has demonstrated the challenge to not only public health, but also economics and also societal stability. If you look at the graph here, that during the March up to September, there is significantly declining like data or whatever the information from all the countries here, where it means that and reflecting that the pandemic make everybody in panic. Yeah, no solution exactly, no evidence, and even we don't have enough knowledge to combat the sudden, high scale and emergent pandemic itself. So the question is what we have to do. Of course, that we can use the evidence and we can plan what we have experienced during the 3 years to make more like a preparedness for future life. And we can use all the evidence during the pandemic to prepare, to make a program to prepare for the future. And when we look at the analysis, we need to have a proactive approach to strengthen our preparedness. And we need the higher education institutions, of course, to have a good collaboration with the government. And I think it is necessary. And the key strategies for the government and higher institution to accelerate the preparedness, of course, is through evidence-based practice here. So through research that is robust, that is done in the collaboration between government and higher education institutions. At least there are 8 key strategies and how the nationwide research agenda can be prepared. So like first, in the country level, we have to support about the collaboration. The secondly is we have to prepare the research infrastructure. I think we experienced that during the pandemic, we see that we are not prepared and our research infrastructure is not enough or sufficiently to analyze, to diagnose, making a diagnostic tools for that. And then number 3 is the research grant and fellowships, and also the early warning systems. Number 5 is we need open access and data sharing. Also, there is a new trend for the pentahelix partnerships, the public-private partnership, that we learn that we cannot work alone. And the number 7 is about the future training and educations, and also the strategies for the evidence-based policies. We will see one by one. Number 1 is for the collaboration. Of course, the government can encourage the higher education to collaborate with more stakeholders, such as public health agencies and also private sector entities. And in this case, we also have to promote the interdisciplinary research that we see that in the field, the problems is very, very multidisciplinary and cannot be solved only by one sector or one discipline only. And we already learned, for example, when we are talking about the shelter, the safe shelter, then we need to look at not only about the infrastructures itself, but also about the social structure and how the psychology of the people in different contexts. And secondly, the strategy for improving the research infrastructure, where I think this is very important, that research capabilities should be guided and should be invested by the government, and the government should provide adequate funding, of course, for the state-of-the-art or the high-quality research infrastructure, so they can prepare for anything that is related with the future need, like for example, how to preparing the vaccine or the drugs for future pandemic. Yeah, so well-equipped laboratories, and then computing facilities or analytic data facilities, yeah, are very crucial for research efforts. And I think this is also the experience that the research is not only for research itself, but it should be very dynamic, where the research is also have close interaction with the context that is faced by the country, because we know that during COVID we move from the Delta and then Omicron, yeah, which each is find out because we do continuous research. And so here the model is not only we are waiting until the research is advanced and the result is advanced, but we keep making continuous data collection and also analysis. And I think this is one of the model that we look at in the scientific or the knowledge process itself. And for the infrastructure, we also have to invest in terms of the resilience itself. Like when we look at the infrastructure, then there are 5 elements that we need to prepare. Like, for example, how is the physical aspects? How is the operation, data protection, safety, and the governance, and so financial. So all these elements have to be resilient when there is something happen in the future. It should be prepared from now on. And the other is we have to see that the resilient research infrastructure as a process. So from the strategy and preparedness, what we need to do, and how to protect and prevent, how is the flexibility, because anything in front is not, we cannot predict and can change and very dynamic, and how is the response and the recovery. Number 3 is about the grants and fellowships. So the funding mechanism should be established, and the government have important role in this area. So like research grants, fellowships have to be, I think, should be allocated for focusing on pandemic preparedness, and this is a must. So these incentives also will encourage the researcher to focus on critical areas, such as we can mention vaccine development, antiviral therapies, or virus transmission modeling, etc. And for the grant and fellowships, I think we also need an evidence-based and peer-reviewed decision choice, that is mandatory research funding, yeah, to allocate the limited budget. Yeah, of course, that we need to have a committee to think about what kind of research, mandatory research that should be provided by the government for pandemic research. And the source of the funding can be from the government or from the crowd. And also we need to have the consideration on short interval research, what I mean that is very easily to be changed, and also the consideration for the output or the outcome impact. Number 4 is we have to prepare the early warning system. What we mean with the early warning system can be, I think, can be data analytic or from the artificial intelligence, to detect that there is a potential pandemic threat in real time. So we can observe, we can prepare when there is, for example, early warning stage 1, stage 2. So we can save more people, and we can have I think the best intervention for that. And we need, I think this is need academic research, to prepare the early warning system. So like for the technical process, so it is early warning systems is basically a proactive process. So we can anticipate when there is an escalations of the event. And we also can develop strategic responses to this crisis. And we can also have options for the critical actors, for decision making, because we know very clear that decision making at that time is very difficult. Very difficult. Can be good, can be right, can be wrong. And it should be analyzed very clear. And number 5 is the strategy for promoting open access and data sharing. This is very important because we cannot work alone, and the pandemic is not country border is not important in here. So everybody can be affected by the pandemic. So here the concerns of data sharing and open access, we learn a lot from COVID-19, like for the safety, the issue of privacy, ownership, and governance, and also the how to standardize and the variability, incentives, or multiplicity. I think from the guide from the Lancet, published by Lancet, we also have learned and can be learned from the Lancet publications. For the data sharing, so the government can mandate open access policies for pandemic-related research findings. So I think this is very important. So we can learn from other countries that perhaps already move forward for certain research, and encourage higher education to share data. I think this is also one of the important development in Indonesia, where the Ministry of Education also proposing for this kind of sharing data for research. And on the other hand, government and higher education also have to work together with private sectors to build safe, open access and data sharing infrastructure. Number 6 is about the partnership, which we learned that public-private partnership is a must. So it is not something that should be but should be parallel, not serial, but it should be together. So we learned from Chinese government that taken step to overcome this pandemic is by utilizing the close relationship between public and private institutions. And this is the transformation from the old concept to the new concept of public-private partnerships. And the government should, I think, give incentive for the collaboration for this, between higher education institution and also private. And now, I think during the past 2-3 years, the Ministry of Education also have several incentives for promoting and encouraging this kind of partnerships. And I think this is number 7, is we have to invest in training and education. And I think this is the main role of the higher education, but the government have to allocate resources and to make sure that training and education in pandemic related discipline is conducted either not only in the higher education, but since the beginning, and also for the public education, and also by cultivating a skilled workforce in areas that is needed, like for example, epidemiology, virology, or public health, so we can better prepare and respond to future pandemic. And also the WHO, I think, do already have several demonstrations for this kind of preparedness. And we also can learn from the WHO how the roadmap of investment in training and educations, like transforming the health education and also focusing on people's needs, ready to respond to emergencies, or ensuring delivery of essential public health functions, or collaborate with partners. And I think I will go for the roles of higher educations here for the training and educations is for transformations and also innovations. And we have to make sure that we meet the needs of the people or the country. And we also have important roles in quality assurance and also in international collaboration and mobility. And I think this is the last strategies that we have to implement the evidence-based policies, and the government, to enable government to implement evidence-based policies. Of course, we need robust scientific evidence that is generated through research. I think I will go to the conclusions that I think investing in higher education research today is, I think, a long investment for healthier and also more prepared, more resilient people in the future. I think that is for the presentation from me, Dr. Yodi, as moderator. Thank you very much for the time.
So we've invited all the audience to submit questions in the Q&A feature, but since time is limited, I'm just going to read one question which we have received. So the question which we received is on interdisciplinary approach. You mentioned that was one of the strategy to support, to enhance interdisciplinary approach. So the question is, in practical terms, what should be conducted by universities to enhance the involvement of other disciplines into health research? So perhaps example from Gadjah Mada or from other observation.
Yeah, I think this is a very, very good questions. We learned from the pandemic that we cannot work alone, either for the research or for the intervention in the community. So, like for example, when we have the vaccinations, we already have the vaccine. One of the other problem is we don't have vaccine. But when we have vaccine, it is also still a problem where not people want to be vaccinated. And so the problem is not only for the vaccine itself, but how to introduce vaccine, how to convince people about the vaccine, and to make sure that this is beneficial for their life. So I think from here, the university will see that pandemic make us work together because we are threatened by the same enemy. So we learned that by this we found a community that we work together, like a task force, where we try to a role to give a role as a advisory with the local government. So what we have to do, what we have to decide, what is the steps, And at that time, we learned that the coordination is very nicely happened. And I think this is, we learned that this is the role of the university, that the university have to provide the valid research data, the valid evidence, yeah, about many things. And then here, the government or the local government will execute it as a policy or the regulations. And I think that is what we learned from the pandemic. And from that on, so we try to create our curriculum and also research agenda based on this I think pattern.
Thank you, Professor Ova, also for highlighting the key message that investing in higher education research is an investment in a healthier and more resilient future. So, ladies and gentlemen, please join me to give a virtual applause to Professor Ova as our first presenter. Thank you, Professor Ova. Now, ladies and gentlemen, we are moving forward to the next speaker. The next speaker comes from Malaysia, Her Excellency Dr. Zaliha binti Mustafa. So, Her Excellency Dr. Zaliha binti Mustafa, she is currently the Minister of Health of Malaysia. Previously, she was the Political Secretary to the Minister of Women, Family and Community Development. She was also a Medical Officer in Pekan and Taiping District Hospitals, Housemanship in Sultan Aminah Hospital JB, and Medical Officer in Penawar Healthcare Group. She graduated with a degree in medicine from University Kebangsaan, Malaysia. She will deliver her presentation through a live video.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and salam sejahtera. Greetings, distinguished guests, ladies and gentlemen. Over the span of the initial 6 weeks of the new decade, the novel coronavirus SARS-CoV-2 rapidly spread to an astonishing 20 other nations worldwide, prompting the World Health Organization, WHO, to officially declare the outbreak as a public health emergency of international concern, PHEIC. Fast forward to the 5th May 2023, a significant watershed moment was reached as the Director General of WHO made a resolute announcement stating that COVID-19 is now an established and ongoing health issue that no longer constitutes a PHEIC. On a global scale, as of the 5th of July 2023, a staggering total of 767 million confirmed cases of COVID-19 have been reported to the WHO, with a tragic count of 6.9 million deaths recorded. The tireless efforts of medical professionals and healthcare system have led to the administration of 13 billion vaccine doses as of the 26th of June 2023. The COVID-19 pandemic will undoubtedly leave a lasting impact on both present and future generations, as it has profoundly affected the lives and well-being of individuals and their means of sustenance. The pandemic forced health systems worldwide to adapt and respond to the extensive needs of their population. It became evident that the interconnectedness of health, society, and economy is undeniable. This unprecedented situation has revealed how vulnerabilities within health system can have far-reaching consequences on a nation's health and economic stability. Numerous challenges were encountered by several Asean countries, especially the overwhelming strain on health system capacities due to the rapid influx of patients. Compounding the issue was the shortage of manpower, insufficient medical equipment and PPE supplies, and scarcity of vaccines. Moreover, the emergence of new variants of the SARS-CoV-2 virus added another layer of complexity to the situations. These variants presented new challenges in terms of transmission dynamic, the efficacy of existing treatments, and vaccines effectiveness. Adapting to these changes necessitated multiple policy alterations, resulting in confusions and uncertainty among the public, further exacerbated by the prevalence of an infodemic or an excessive amount of misinformation. Malaysia's effective response to the COVID-19 pandemic demonstrated our health system ability not only to plan for shocks but also to minimize the negative consequences and recover as quickly as possible. However, the pandemic also revealed the gaps our current healthcare system face, highlighting the need to re-evaluate the sustainability and resilience of our healthcare system. It is important to ensure that ASEAN member states work cohesively together to strengthen the ASEAN region's public health emergency preparedness strategies, continuously improving standards operating procedures, guidelines, surveillance and response plan at all levels, and conducting regular exercises are crucial for ensuring optimal preparedness. Through the ASEAN Health Sector Platform, Malaysia led the ASEAN Emergency Operation Network (EOC), where member states contributed through initiatives for capacity building and the exchange of technical and clinical information, which are vital for managing the region's effort in building a resilient regional health system. We must also continue to utilize the learn and improve mechanism that was put in place during COVID-19 pandemic. This mechanism relies on strong networks and information sharing between WHO member states, WHO and partners, which are essential to identify common challenges and solutions. The progress made in surveillance and public health response capacity during COVID-19 pandemic should not be lost. Government should prioritize maintaining and strengthening these capacities, including advancements in testing, diagnostic, and genomic surveillance, as well as establish network and partnerships. Balancing resources with testing capacity and public health objectives is crucial in developing effective testing strategies. Acknowledging the importance of enhancing the nation's capacities and capabilities for preparedness, surveillance and response through collaboration between ASEAN member states and its partners, ASEAN developed the ASEAN Public Health Emergency Coordination System, APEX, which will integrate within the operationalizations of the ASEAN Center for Public Health Emergencies and Emerging Diseases, which will be vital as the center of excellence and regional hub in accelerating the regional COVID-19 recovery and preparing the future public health emergencies. Our experience with the pandemic propelled the expansions of digitalization of services, including remote support, medical consultation, healthcare services, contact tracing, and infectious disease monitoring, which ensured the continuity of access to routine health services. Technology adoption was accelerated and propelled in a short span of time. With initiatives ranging from community use solutions to operational strategic level digital system, governments must utilize this unique opportunity for innovation and improvement in the health sector and industries to improve our infrastructure and connectivity. Local government must prioritize comprehensive risk communications and community engagement, establishing trust with the populations and ensuring transparency in communicating pandemic information will enhance a whole of government and a whole of society approach. Malaysia, for example, evolved at record speed by creating digital initiatives overnight for the general population for public health interventions and activating real-time disseminations of verified information. Multi-sectoral collaboration is necessary in preparing for future pandemics. Coordination with the wider health sector and system beyond health is necessary to ensure effective planning and response. This was evident when we saw the effectiveness of public-private partnership established during the massive COVID-19 vaccination exercise, aiming to ensure equal access of the COVID-19 vaccines for all population. Investment in research should be a long-term commitment parallel to investment in the health sector. Research invaluable not only for developing effective medical countermeasures but also for addressing social determinants of health during public health emergencies. Further research on public health and social measures will improve our ability to maximize the impact and minimize harm in future pandemics. Among the challenges in our healthcare systems are imbalances in service delivery, limited funding for health, and gaps in private health insurance. Sustainable financing is crucial for strengthening the global architecture for the health emergency preparedness and response. Governments should establish pandemic funds to provide long-term funding, bridge existing gaps, promote coordinations, incentivize increased investment, and advocate for stronger healthcare system. By investing in healthcare and strengthening delivery system, we can better prepare for future pandemics and avoid stumbling into them blindly. In conclusion, the COVID-19 pandemic has undoubtedly been a significant catalyst for change in public health interventions. ASEAN countries have been forced to adapt quickly and implement measures to combat the virus. This experience has highlighted the need for comprehensive and holistic approach to future pandemics. By learning from the challenge faced during pandemic, ASEAN countries can be better prepare their systems and enhance intersectoral collaboration. It is paramount to build the capacity of society to withstand and absorb the shock that future pandemics may bring. While it is impossible to predict the exact nature of the next pathogen or its impact, continuous investment in prevention and preparedness by each Asian country's government is imperative. We must remain encouraged and motivated to prioritize public health initiatives and ensure that the necessary resources are allocated. By doing so, we will be better equipped to handle future pandemics and protect the well-being of the Asian community. Together, we can create safer and healthier future for all. Thank you.
Thank you, Dr. Zaliha, for that insightful presentations and highlighting the government role on post-COVID-19 preparation managing the future pandemic. You've highlighted the significance of the COVID-19 and catalyzing changes in essential public health functions across the world, and that ASEAN countries could actually learn a lot from the pandemic to be better prepared for the next pandemic. Now, I'm sure this has sparked a lot of questions from the participants, but since this was a taped video, we will not be able to entertain discussions directly. But if you have questions, please do leave your questions or opinion in the Q&A box, and the committee will help to collect them and send them to our speaker later. So, Excellencies, ladies and gentlemen, we will move on to our third speaker, Dr. Sourioudong SUNDARA. Dr. Sourioudong SUNDARA is the Vice Minister of Education and Sports from Laos, and he was previously the Vice Minister to the Ministry of Science and Technology in Laos, and he completed his postgraduate study at the Communique University, Czech and Slovak Federal Republic. Dr. Sourioudong SUNDARA is going to speak to us on the government role in higher education, accelerating research, and building a resilient education system to better prepare for future pandemic. Dr. SUNDARA, we're delighted to have you today. Can you hear us clearly?
Yes.
Okay.
Okay.
Thank you very much. Yes, please.
Please, the chairman, please finish. Yes. On behalf of Ministry of Education, Sport of Laos, I would like to join the ASEAN colleague to express my sincere thanks to Indonesia for for organizing the main fund event related to higher education with a keynote on government role in higher education to accelerate research and better prepare for the future pandemic. Today, I would like to share the importance of research on future pandemic preparedness and the government role to accelerate the research in higher education. Laos PDR has had encountered with the COVID-19 crisis, which provide the knowledge platform for educator and actor to share their experiences on education, science, research, and culture that will have to support, enhance the learning outcome and commitment to promote the internationalization in higher education for our future generation. We have prepared education strategy to link the fourth industrial revolution, promoting gender equality in education, strengthening higher education to internationalization strategy, student mobility and exchange, as well as providing the education quality capacity building for teachers in the field of ICT, in teaching and learning, to education into more digital, by promoting STEM education, scientific research, and innovation. Therefore, the government has an important role in higher education to accelerate research for the pandemic preparedness. Some of the way that the government can support and promote research in this area as follows. First, providing adequate and sustainable funding for research institution, project, and program that focus on the pandemic preparedness, such as surveillance, prevention, detection, response, and recovery. Second, the establishing clear and consistent policy and regulation that facilitate the research, collaboration, data sharing, ethical standard, and innovation across sector, discipline, and countries. Third, the enhancing the capacity and quality of higher education faculty and students to conduct the rigorous research on pandemic preparedness by means of training, mentoring, infrastructure building, and incentive providing. Finally, is the engaging with stakeholder and community to ensure that research on pandemic preparedness is aligned with their need, priority, and perspective, and that the results are communicated effectively and translate into the action. By playing this role, the government of Laos PDR can foster a culture of research excellence and impact in higher education that can contribute to better preparedness for future pandemic. In closing, I would like to highlight the importance of regional and international cooperation to foster research for pandemic preparedness that can be done in several ways, such as first, participating in network and platform that coordinate and fund research on pandemic preparedness. Second, sharing data information, best practice, and research output on pandemic preparedness and response. Third, collaboration and joint research projects supporting the capacity building and resilience for low and middle income country to conduct and use research for pandemic preparedness, such as through technical assistance, training, funding, and partnership. The last is the aligning national research agenda and policy with a regional and global framework and recommendation for pandemic preparedness, such as the international health regulation and the One Health approach, and the independent panel for pandemic preparedness and response. Once again, I would like to note that cooperation for preparedness at sub-regional, regional, and global level is important because one country weakness in preparedness can translate into regional and global weakness. Last one, I hope that with our close collaboration and knowledge sharing in education, science, and culture will help us to achieve the sustainable development agenda by 2030. Last but not least, I wish Mr. Chair and own delegates have happiness and great success in your noble duty. Thank you very much. Thank you, sir.
Thank you, Dr. Sundara Khopchai. So thank you for sharing with us your thoughts on government role in higher education, accelerating research and building a resilient education system, and highlighting again and again the importance of regional and international collaborations. Ladies and gentlemen, Dr. Sundara will not be able to join us for the Q&A, but please welcome to submit your questions in the Q&A, and we will share with him later your question for him to respond afterward. Thank you again, Dr. Sundara. Let's give a virtual applause for Dr. Sundara. Thank you, Khopchai.
Thank you, Khopchai.
Ladies and gentlemen, next we move to our fourth distinguished speaker. He is from Singapore. He is the Dean of the Yong Lin School of Medicine, NUS, Professor Chong Yap Seng. So Professor Chong Yap Seng is currently the Dean of the Yong Lin School of Medicine, NUS. At the same time, he is also as the Deputy Chief Executive of the NUHS and also the Chief Clinical Officer of the Singapore Institute for Clinical Sciences of the Agency for Science, Technology and Research. Professor Chong Yap Seng, can you hear me clearly?
Yes, I can. Okay, I'll now share my slides.
Okay, welcome. Thank you. And the time
Thank
is
you.
yours.
Okay, good afternoon, Excellencies, distinguished speakers and participants, guests, ladies and gentlemen. My presentation today is on vaccines and international mobility. The recent COVID-19 pandemic resulted in severe restrictions to international trade and travel throughout most of 2020 to 2022. This also affected the flow of international students and academics. The Strategic Preparedness and Response Plan produced by the World Health Organization describes the 11 pillars of outbreak response, 8 vertical pillars and 3 cross-cutting horizontal pillars. These pillars are critical elements in the response to COVID-19. The 8th vertical pillar highlights how vaccines are a fundamental part of outbreak response, while the 3rd cross-cutting horizontal is how research, innovation, and evidence equip us with the knowledge to manage an outbreak, with research in vaccines in particular being a key enabler. COVID-19 vaccines became commercially available at the end of 2020, but it's only after mass vaccination rollouts in 2021 and 2022 that countries started to open up again when the majority of their at-risk populations had been vaccinated. It is clear that rapid vaccine development and deployment will be key in reducing the risk and duration of mobility restrictions in future pandemics. During the 2022 Global Pandemic Preparedness Summit in London, the Coalition for Epidemic Preparedness Innovations, or CEPI, set a 100-day goal for delivering safe and effective vaccines and therapeutics for the next pandemic. In order to achieve that, it is incumbent on us to reflect on the lessons from the present pandemic and to improve on current processes. The mission to develop vaccines within 100 days of a new virus being identified through tools such as a library of vaccine candidates that can be adapted to tackle different pathogens is not unrealistic. In a recent interview in Singapore, Richard Hatchett, CEO of CEPI, compared the advancement of vaccine development, which used to take several years, to the evolution of pit stops at Formula One races. Such pit stops used to take up to a minute and now takes no more than 3 seconds without compromising safety. I think if we can deliver vaccines within 100 days, we actually get within striking distance of being able to prevent pandemics altogether, said Richard Hatchett. First, perhaps we need to acknowledge that the development, testing, manufacturing and global distribution of the COVID-19 vaccines is first and foremost a miracle. The success of mRNA vaccines took most of us by surprise. Previously, the fastest any earlier vaccine had been developed was 4 years for mumps in the 1960s. The shots developed by Pfizer, BioNTech and Moderna took less than 12 months. While this technology had not been used previously for any existing approved vaccine, it's important to note that mRNA vaccines were built on over 3 decades of basic research in the mRNA field with limited funding, recognition from the scientific community, and interest from biotechs and big pharma. This shows the importance of continuing basic discovery science even when the translational and commercial values are not clear at the outset. Research funders would do well to remember this important point. Paradigm shifts also occurred in the clinical development and regulatory approval processes for the pandemic vaccines. For example, clinical development phases were initiated prior to completion of earlier phases, with phase 2 and 3 clinical trials initiated based on interim results from phase 1 testing. Emergency use authorizations were also granted based on rolling reviews from regulatory authorities, with data packages amended as new information became available. This was only possible because, one, a higher level of financial risk-taking was accepted by both private and public sectors, which expedited assessment timelines. Two, in several cases, such as the development of the Moderna vaccine, public sector or government funding was used to offset the financial risk for many vaccine companies. And three, there was an unprecedented level of cooperation between the regulatory authorities and the industry and product development to market. There were also other factors which allowed us to rapidly develop multiple vaccines against COVID-19. First of all, importantly, we had the entire genome sequence of the virus within weeks of the epidemic occurring in Wuhan. Two, we were also fortunate that there had been years of research and laboratory evidence with other outbreak coronaviruses, such as SARS and MERS, enabling the rapid focus on the spike protein as a target for the vaccines. There were also multiple innovations in the implementation of clinical trials, including innovative trial designs, the use of modeling to identify emerging hotspots for opening trial sites, and the use of remote control tower monitoring of distant clinical trial sites. The last is particularly important in view of the mobility restrictions during the pandemic, which severely limited the ability of the clinical trials team to make site visits. What this pandemic has shown us is that for most diseases, vaccine efficacy is a continuum that depends on the host, pathogen, and the vaccine. Very few vaccines in real life offer sterilizing immunity, that is, protection against infection. Most vaccines offer protection against both disease and infection to a certain extent, but for respiratory viruses such as COVID-19 and influenza, protection against infection wanes within months as circulating antibody levels naturally drop over time. However, protection against severe disease is more long-lasting. Hence, people vaccinated against COVID-19 are still protected against severe disease when they get infected post-vaccination. This protection is not complete, of course, and in the elderly and frail, there remains a small risk of dying from COVID-19 even after booster doses of the vaccine have been administered. Pandemic preparedness is currently high on the agenda of many countries around the world that have acknowledged how ill-prepared we were. Pandemic preparedness programs have thus been initiated, which include the development of pandemic vaccines. While much has been accomplished during the pandemic itself, much more remains to be done during peacetime. With COVID-19, science had delivered a miracle, and with that, a list of possibilities. We have had multiple innovations in all the various aspects of vaccine development and rollout, which will stand us in good stead for future pandemics. We also have a more nuanced understanding of vaccine efficacy, effectiveness, and protection. However, we need society support if we do not want a repeat of the COVID-19 pandemic, and one major barrier for humanity is vaccine hesitancy. Vaccine hesitancy, defined by the World Health Organization, is the delay or refusal of vaccination despite the availability of vaccination services. On one end of the continuum, there is the small but vocal minority of people, approximately 3%, who refuse all vaccines. On the other, there's the majority of the population who accepts all vaccines. And in the middle, we have individuals who are hesitant, which could include people who accept most vaccines but refuse others, such as the annual flu shot, or folks who ask for alternative schedules and space out vaccines for their children during the crowded pediatric visits. Efforts right now are focused on equipping the group in the middle of the spectrum with information and or resources that can help shift them towards vaccination acceptance. In a recent article in Nature Human Behavior, published in November last year, an extensive review of over 400 articles, the authors, Busing Vuren et al., made a strong case for distinguishing between hesitancy and behavior. and argue that including behavior within a definition of vaccine hesitancy is not tenable. In their conclusion, the authors propose that vaccine hesitancy should be defined as a state of indecisiveness regarding a vaccination decision. There are complex intersecting factors that come together to shape people's decision-making about vaccinations. However, by focusing on individual decisions, it is easy to overlook other reasons and structural factors like politicization, distrust of the health system due to systemic racism, social inequalities, and access to vaccines that contribute to suboptimal vaccine uptake. A recent study published in Political Communications in March this year found that Fox News coverage was significantly more negative than that of other cable and mainstream sources, and is associated with increased negative public vaccine sentiment. At the micro level, self-reported Fox News exposure was associated with increased vaccine refusal. Collectively, the results highlights very real public health consequences of vaccine politicization in America, where partisan identity has become one of the primary determinants of vaccination decisions that may spill over to the uptake of other vaccines. The politicization of science can limit the positive impact of scientific advances and result in problematic health policy consequences. Trust is another key determinant of vaccine hesitancy, and there needs to be more efforts geared towards increasing trust. A recent study found that trust in science is negatively correlated, while trust in social media and the use of social media as the main source of information are positively associated with vaccine hesitancy. Pre-COVID, people were already listening to and seeking health advice from their peers or family, and many tend to pass on information to their peers or family without checking to see if they're accurate. Crises like the COVID-19 pandemic unleash fake news and alternative facts, and the spread of unverified information on the side effects and manufacturing processes of COVID-19 vaccines warranted the Ministry of Health and the government to put up notices and clarifications to stem untruths in Singapore. In Singapore, a doctor was even charged in court for colluding with the founder of an anti-vaccine group to cheat and submit falsified vaccination records. In order for the public not to rely on hearsay, one way is to share with them the real facts and evidence from experts in a way that relates and appeals to them. For example, NUS Medicine teamed up with the Global Outbreak Alert and Response Network at the World Health Organization to create the COVID-19 Chronicles in the early days of the pandemic, so that people in Singapore could get accurate, timely advice that was authoritative, easy to understand, and complied with evolving precautionary health measures aimed at breaking the chain of transmission and preventing new cluster outbreaks in communities. We thought the best way to do this was through a series of short comics which would have universal appeal, and so the COVID-19 Chronicle comic strip was born and was actually translated into many languages and distributed around the world. The other equally important aspect of ensuring safety for everyone is access to vaccines. During the COVID-19 pandemic, the majority of high-income countries, including Singapore, obtained vaccines way before the low and middle-income countries. They were able to cut deals more rapidly with the pharmaceutical industry, paying a premium for the vaccines that is beyond what low and middle-income countries were willing to or able to afford. While there were some efforts made by high-income countries to redistribute excess vaccines, more needs to be done to close gaps globally and increase vaccine access in low and middle income countries. After all, no one is safe until everyone is safe. The COVID-19 vaccines global access, or COVAX, co-led by CEPI, Gavi, and WHO, was set up with the aim to deliver 2 billion vaccine doses around the world by December 2021. This diagram here illustrates COVAX model of operations. UNICEF and the Pan-American Health Organization Revolving Fund essentially serve as the distribution partners of COVAX, ensuring that vaccine doses bought from pharmaceutical companies obtained from high-income countries reach their targets in low and middle-income countries. Although COVAX did not achieve its goal, its efforts benefited a large number of people in low and middle-income countries. Some key innovations include: 1. pooling funding from donor governments and self-financing governments in order to sign advance purchase agreements with manufacturers to supply low and middle income countries with vaccines. 2. Redistributing excess vaccine doses from high income countries to low and middle income countries. 3. Establishing a global no-fault compensation program for vaccine makers. And 4. Helping multiple low and middle income countries scale up ultra cold chain logistics for the mRNA vaccines. While the COVAX initiative is set to wind up end of this year, global efforts to improve vaccine equity needs to continue. There are vaccines to prevent more than 20 life-threatening diseases, but in some countries, access to vaccines is still an issue. Progress has stalled and even reversed in some places. The World Health Assembly has endorsed a new global vision and strategy called the Immunization Agenda 2030 to address these challenges over the next decade and aims to maintain hard-won gains in immunization and recover from the disruptions caused by COVID-19. Now, let's switch over to ASEAN. This figure shows a varying rate of vaccine uptake among our countries, ranging from over 100% in Brunei to rates below 80% for other countries. Contrasting the COVID-19 vaccination rates to routine but critically important childhood vaccination, for example, measles, you can see from the table that only 3 countries in ASEAN have achieved measles elimination, although Malaysia may put in an application for verification this year. The measles vaccination rates are also highly variable, with many of our countries below the 90% target that is needed for containing this highly contagious virus. It is also clear that vaccination rates dipped significantly during the years of the pandemic in several ASEAN states. But these rates also broadly correspond to COVID vaccination rates, and it is clear that for a future pandemic, we should best start with improving vaccine acceptance and vaccination rates of routine childhood vaccines. Regional outbreaks and the threat of future pandemics will strain even the most resilient health systems. Vaccinating ASEAN is our best safeguard against many communicable diseases and will contribute to our region's health security. We need to work together by sharing with each other our expertise and resources because we are only safe when everyone is safe. In addition to increasing childhood vaccinations, I would like to highlight 2 key initiatives that we should consider in ASEAN. The first is regulatory convergence, which is a process where the regulatory requirements across our countries become more similar or aligned over time as a result of the gradual adoption of internationally recognized technical guidance documents, standards, and scientific principles. The aspiration is for regulatory harmonization, where these processes become uniform. Regulatory convergence will aid the more rapid evaluation and approval of future vaccines or therapeutics. Secondly, it is important for ASEAN to be part of the global vaccine value chain. Vaccines, like most modern products, are largely not manufactured in any single country. The constituents come from many different countries, and most companies develop vaccines as part of a network. This figure here shows the situation in ASEAN. So you can see that there were 5 vaccine-producing countries in ASEAN with 13 manufacturers located variously throughout our countries. In 2021, Thailand, which has been active in vaccine research and development for several decades, began producing AstraZeneca's COVID-19 vaccine. In October 2022, Indonesia launched Indovac, its locally produced COVID-19 vaccine. Prior to COVID-19, Singapore did not have a single facility producing finished vaccines. Over the past 2 years, however, 5 pharmaceutical companies have committed to set up plants in Singapore, which will, at steady state, churn out over 1 billion doses annually. Singapore will also be contributing $15 million over the next 5 years to CEPI, a global coalition set up to develop vaccines against future infectious disease threats. The hope is for countries in ASEAN who are not yet able to become vaccine manufacturing hubs to aim to be part of the vaccine global chains over the next decade in preparation for future pandemics. Now that the COVID-19 pandemic is supposedly over, what have we learned? 1. Crises unfold in unexpected ways. There are still potentially unexpected developments ahead. 2. Crises unleash fake news and alternative facts. As David Moynihan said, everyone is entitled to his own opinion, but not his own facts. 3. Critical inquiry is essential. Science should remain the fundamental basis for rational decision making. 4. We need to learn from the past. Those who don't know history are destined to repeat it. 5. Crises disproportionately affect the poor and vulnerable, exacerbating inequalities and class divides. We need to embrace equity and moral purpose. Everybody matters. 6. A global mindset is necessary. As my good friend Kishore Mahmood said, to survive in the short term, we need national solidarity. But to survive in the long term, we need global solidarity. Excellencies, ladies and gentlemen, we have been through a lot this past 3 years. We need to crystallize the lessons we have learned and make sure we don't forget them too soon. Thank you.
Thank you very much, Professor Chong, for sharing your insights on vaccines, international mobility, and also all the nuances related to vaccine hesitancy, politicization, distrust, also ramping up vaccine production in ASEAN, and also what are the key lessons that we can draw from the COVID-19 pandemic. Now, the organizer is collecting questions from the Q&A, but because time is limited, I'm just going to read you one question which we have received. So the question which we've received is, what do you think is the role of artificial intelligence in terms of accelerating vaccine development for the future pandemic? As you highlighted the target of CEPI for 100 days, which, as you say, is ambitious but not unrealistic. So how do you see the role of artificial intelligence in accelerating vaccine development? Question?
Thank you. That's an excellent question. I think many people, including us, have a lot of hopes regarding the role of artificial intelligence in health and healthcare and in advancements in biomedical science. So I think the various places where it can be used is one is just simply predicting potential outbreaks just by looking at social media comments and monitoring that. So that can actually help trace potential hotspots and identify places where outbreaks may be beginning. So that it has a role in surveillance. In terms of scientific advance, obviously, artificial intelligence will boost productivity and help identify new targets and ways to manage new disease conditions. And finally, I think in the distribution of vaccines and other therapeutics, again, AI can possibly come up with more efficient distribution channels than what is normally planned by using conventional means. So I think at least in these three areas, AI will be a major boost to the way we manage the next pandemic.
Okay. Thank you, Professor Chong. We have other questions, but since we're running out of time, if you don't mind, we will share with you the questions after this. And if you have the time to respond, we will share it with the participants. So thank you again, Professor Chong, and please give a virtual applause to Professor Chong for his presentation.
Thank you.
Thank you. Now, ladies and gentlemen, we're heading to the last but not least speaker. Here we have Mr. Shadik Akasha. Mr. Shadik Akasha is the CEO of PT Bio Farma Indonesia. Previously, he has a long track of career at the bank sector at BNI, starting ahead of the Jakarta Senayan region, head of institutional relationship, and lastly, the president director of PT BNI Life Institutions. Mr. Shadik Akasha will share his insights on challenges and prospects from private sector and vaccine research through a video.
Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, distinguished guests, and esteemed participants, good afternoon and welcome to this session on a challenge and prospect for the private sector in vaccine research. I am honored to be here today as we greater explore some of the interesting points of vaccine research. Biopharma Group as a holding company are officially formed on 2020. The pharmaceutical SOE holding currently consists of Biopharma as the holding company, Kimia Pharma Group, Indopharma Group as a subsidiaries. However, Biopharma itself has been established 133 years ago and has a process various of vaccine. Each of our subsidiaries has complementary field with biopharma specialization in vaccine, serum, and life science. Kimia Pharma is engaged in pharmaceutical, distribution, retail, health service such as clinic, laboratorium, and Indopharma is engaged in herb, medical devices, and pharmaceutical. As a holding, we are distributed vaccine product to 153 countries in the world. We have 13 manufacturing facilities spread throughout Indonesia and have the largest distribution network in Indonesia. Biopharma Group serve customer with the deserved profile ranging from the government sector, private sector, and bilateral, etc. In establishing resilience in terms of supply chains, for the entire holding, Biopharma Group has a vision to become an integrated end-to-end ecosystem. This integration will certainly greatly affect to the company's readiness to face uncertain market challenge and develop the maximum potential of the company. The integration of the healthcare ecosystem in Biopharma Group Holding is divided into 4 aspects and 8 activities. First, the aspects include business and corporate development, strategy, transformation and selective operation, finance and performance management, human capital and risk management. Number 2, the activities include R&D and product development, manufacture, commercial, trading and distribution, healthcare service, retail, third-party administration and insurance, and digital. Research and development will be focused on being coordinated by the Indonesian Healthcare Institute, where we are involving trends, technology, and knowledge. Will be incubated into series of strategic steps of the company to prepare for the future. Reflecting on the condition of COVID-19 pandemic that had hit the world, all pharmaceutical companies are competing to find the most effective and efficient way to meet the needs of the wider community. As we know, before the COVID pandemic, the time needed to conduct research and development of a type of drug vaccine can take about 10 years. Even most pandemics and pharmaceutical industries stalwart would consider a development timeline of less than 5 years to be higher unusual. But when pandemic conditions occur, the research and development process can be accelerated in just 1 year. This is the next challenge when the pandemic is over. How can we continue the impact of global health factors by remaining the rhythm that we have achieved when talking the COVID-19 pandemic? The accelerated condition that can be carried out in tackling the COVID-19 pandemic are purely due to the full collaboration of the stakeholders parties involved in it. The scheme is listed by the name pentahelix model, where research and development collaboration can run holistically among academia, industry, government, community, and of course media. The full support given by the stakeholders make a good synergy and has a quick impact of the wider community. Academia with all the development of new knowledge, trends and method. Industry with the ability and availability of adequate production and distribution facilities. The government with policies and regulation that serve a guideline for the community. And the community with the capability to open data of needs and advocacy. And the media in the role of socialization, education, and rapid dissemination of information. So that the challenge of maintaining collaboration among stakeholders such as pentahelix model, this makes a paradigm shift in the needs that are expectation of the wider community of vaccines and immunization. This expectation include: 1. It is necessary to have speed and timelines of vaccine drug products to be accepted by the public, so that is required a broad product portfolio with various manufacturers. Number 2, because of the number of need is dynamic, it requires that the resilience of the company supply chains and increase in the capacity. Number 3, higher competition where innovation is in main drive so that companies can quickly innovate will continue to be concerned to the wider community. The last is the position of vaccine as one of the support of biosecurity, where people are increasingly aware of the urgency of vaccination and are starting to pay attention to more detailed aspects, especially safety. Several vaccine models that are still in prospectus in the future include: number 1, high income and nosocomial vaccine, which targeting healthcare acquired infection with larger burden in high income markets such as diarrhea, flu, and etc. Number 2 is potential blockbuster vaccine, which targeting high burden disease with the large potential patient tools such as HIV, hepatitis C, etc. Number 3, vaccine with incremental improvement to address optimization in the formula such as pertussis, typhoid, and measles, etc. Number 4, vaccine for the emerging threats with targeting emerging epidemiology such as Ebola, Zika, and etc. Number 5, vaccine with the low-income markets that targeting such disease with the higher burden in the low-income markets such as malaria, tuberculosis, and others. I think it's enough for this presentation. Thank you very much for your attention. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Mr. Shadik, for sharing with us your insights all the way from an end-to-end ecosystem for the vaccine development productions, how it's accelerated significantly due to the COVID-19 pandemic, the pentahelix model, the reframe expectation for the immunizations, and some of the vaccine archetypes, which is still prospectus for the upcoming season. Now, ladies and gentlemen, since Mr. Shadik delivered his presentations through a video recording, we will not be able to entertain direct Q&A, but again, you are more than welcome to leave your questions or opinion on the Q&A box, and the committee will help to collect them and share them with Mr. Shadik for his response. So as we are approaching the end, let me end this discussion sessions in a traditional way, which is by reciting a pantun. For those of you who are not familiar with pantun, it's a traditional form of poem which is quite popular in Indonesia and also in Malaysia, I believe. So the pantun goes like this. In the wake of trials, a vision takes flight, a post-COVID world bathed in hopeful light. Healthcare and industry, hand in hand, building a future that's truly grand. Vaccine and treatment, fruits of innovation, eradicating disease with swift determination. From bustling hospitals to factory floors, a sustainable path society restores. So let us envision a post-COVID age where health and industry align on one page. Hand in hand we pave the way for a brighter future, come what may. Thank you very much again to our speakers, Professor Ova, Dr. Zaliha, Dr. SUNDARA, Professor Chong, and Mr. Shadik. Dr. Eta.
Thank you very much, Dr. Yerdi, for moderating our session excellently, and thank you to all speakers for the insightful presentation. Ladies and gentlemen, we are so delighted to see the great enthusiasm during this webinar, but unfortunately, we have come to the end of the session. And we'd like to give you the warmest gratitude for your participation and also attention. Hope you find this webinar to be fruitful and engaging. And ladies and gentlemen, please don't forget to join the next webinar that will be hosted by Universitas Indonesia on the 16th of August 2023. So it will be in the next week under the theme of innovative collaboration. That's all, ladies and gentlemen. I am Eta Aurea as your Master of Ceremony signing out. See you in the next event. Good afternoon. Wassalamualaikum warahmatullahi wabarakatuh.